Okay. Now, insomnia is the big one, but are there other sleep disorders that we're kind of seeing spikes due to current events?
It's really interesting, and this is a bit more anecdotal. We don't have a lot of good data yet, but we're hearing a lot more people struggle with disturbing dreams and nightmares. Um, it probably emerges from some of the same causes of insomnia. So, spending more time in bed and having more fragmented sleep means that you're more likely to wake up while you're having a nightmare and remember it in the morning and be distressed by it. When your sleep is solid and good quality, you may still have some disturbing dreams now and then, but you might actually just sleep right through them and not wake up. The other issue is that we are exposed to a lot of very disturbing visual images when we interact with technology and the news media. And we do know that the images that you're exposed to during the day, especially if it's close to bedtime, tend to come out in our dream content. So those two things probably account for an increase in nightmares. We haven't seen a lot of increase in symptoms of other sleep disorders, but again, there's just not a lot of hard science out there for us to rely on quite yet.
Do you think we're going to, just because the patient pool is kind of expanding, do you think we're going to learn a lot about some sleep patterns and sleep issues as we kind of study a bigger pool of patients?
Well, I think we're going to learn something really interesting about some of the things that we used to do instead of sleeping. So this, outside of the domain of insomnia, a lot of people complain that they're sleepy and tired during the day, and a big reason for it is that they simply aren't spending enough time in bed, especially during the work week. As people have been working from home more and maybe not spending so much time commuting to and from their place of work, uh, I think that there will be some changes in our attitude about what some of the tasks are that we used to do instead of sleeping. Because I do think that people who were sleep deprived before are feeling less so now. Um, in the case of insomnia, I think one of the interesting things will be uh, that there is a higher level of awareness now, I think, than there was in the past. And I'm kind of curious whether people will start seeking treatment earlier. In my own practice, the typical length of time that a person has insomnia before they come in for treatment is longer than 10 years. So I'm hopeful that people will actually recognize the problem earlier and reach out for help before they've struggled with it on their own for a decade.
Now, what about what have we learned with pediatric patients and even young adult patients who maybe are used to having a more expansive social life? Pediatric patients are more used to at least being in school, even if they're young. What have we learned about their sleep habits the last 3 months?
Well, I can speak as a parent of two teenagers who stopped going to school and share my observations. And also, the state of California, before the COVID-19 pandemic, had passed a law mandating or a no earlier than start time for high schools and middle schools. The reason for that is that teenagers in particular tend to have a naturally later sleep schedule, and they still need more sleep than adults. So a teenager probably needs, say, 8.5 to 9.5, maybe even 10 hours of sleep in some cases. But on average, a teenager in high school gets only about 6 or 6.5 hours of sleep on a school night. So one of the observations that I've had is that my kids are sleeping longer and later, not terribly later, but a little bit later, maybe an hour or so. And they're waking up on their own. Their online classes are much easier, I think, because they're better rested. I actually, to be honest, I've been surprised by how much more sleep I think they need than even I thought as a sleep specialist. So I think that one of the interesting observations for teenagers is that they have the opportunity to sleep a lot more. Now, the social isolation is probably not good for them over the long run. So I think for people who have kids, doing things to try to help them feel connected to their peer groups, encouraging them to do Zoom birthday parties and things like that that help them stay connected is really important for their overall well-being. But in terms of their sleep, I think actually this has been an interesting opportunity to really look at how much sleep teenagers need. Um, we do need to be careful that they're not staying up all night watching television and then sleeping all day. That's not helpful, but definitely giving them an opportunity to sleep a little later and get the rest that they need.